So John, Dr. John Henderson, here we are, day 2 of the horse show. Your first horse show. How are you finding it?
Very good, Kirsty. Yeah, very enjoyable. Yeah, the weather's good, better than anticipated, so it's all good. What about you? This is your 34th horse show, I believe.
Possibly, yeah. Possibly, yeah. No, look, we're delighted to be back here, and yesterday we had a great day, and you know, Dr. Ian Roundtree, he brought us through digestive health, and that was fantastic. And today you're going to talk us through respiratory health.
Just a little bit on the respiratory system, just to get the basics, and then we know where we're going if there is a problem. Absolutely. Yep. So the respiratory system of the horse encompasses everything really from the top of the windpipe or the trachea back to the base of the lungs, and the business end of the apparatus is here, where the small little air passages, the bronchioles, which terminate in the air sacs, the alveoli, they take the oxygen and insert that oxygen into the bloodstream, which then goes to supply muscles and give the horse its athletic ability.
Super.
Now, even though a horse's lungs are roughly the same size and weight in comparison to a person's, they are much, much more effective and can do much harder work than we can. So a horse at exercise can actually increase the blood supply to its muscles by 40 times over its resting level of oxygen, whereas a human, like Sonia here, can only increase her oxygenation levels by 6 times. So the horse really can put its respiratory system to work much, much more effectively than we can. That gives the horse athletic ability way over our own. So a quarter horse has been timed at a top speed of 55 miles per hour, and at that it's generating around 15 horsepower in one horse, which is not a bad trick. Whereas the best that humans can do is Usain Bolt, who managed the top speed of 27 miles per hour and can generate 1.2 horsepower.
And obviously this quarter horse was only travelling over a short distance.
Yeah,
so
exactly.
our thoroughbreds would be, you know, hitting around, they wouldn't be hitting the 55s, be slightly lower than that, but they're travelling over a further distance. So we've got like an element of anaerobic and aerobic respiration.
Yeah, there is, of course, you know, I think the horses at that speed, the quarter horses, they will always be operating on an oxygen debt, so there will be lactic acid buildup, which of course can cause its own problems. But yes, the fastest breed of horse in the world is the quarter horse, which is named because it races over a quarter mile. The thoroughbred is, of course, the supreme equine athlete and will reach speeds, I think, 53 miles per hour over, you know, your 7 or 8 furlong sprints, which is longer than a quarter mile. The true long-distance endurance athletes in the equine world, of course, are the Arabian horses, and you know, in those days the Arabian horse owners couldn't encompass the idea of a horse race that took anything less than 2 days. So the whole idea of horses' athletic ability has changed and depends very much on the breed of the horse.
So it is remarkable. We always talk about, we hear, you know, people saying that food, like what the horses eat, that's their fuel. But realistically, it is oxygen that's their fuel for galloping and things like that. Isn't that correct?
It absolutely is. Oxygen is going to be the limiting factor. If they can't get oxygen into the bloodstream, if that bloodstream then can't carry the oxygen to the muscles for muscle respiration, then you're going to get muscle fatigue, tying up, and all the problems that go along with that, the horse fading in the parts of the race. So the horse's aerobic capacity is all important, and obviously there's variation from horse to horse, and I suppose that's what makes the Franklins the Franklins. So how does the horse breathe? Well, at walk and trot, the 4 gaits of a horse, the first 2 gaits, the walk and trot, the horse expands its chest as we do. So it opens up the rib cage, that creates negative pressure in the chest and sucks air in. However, at the 2 faster gaits, canter and gallop, breathing is actually a function of the back and forward movement of the gut contents crashing into the diaphragm. So the horse actually can't control its breathing. It's the movement of its internal organs. So at the canter and gallop, the horse is obliged to breathe at a ratio of 1-to-1 breaths per the stride. A horse can't actually breathe faster at the gallop. It all comes down, I suppose, to innate ability of the apparatus inside the horse's chest. The respiratory rate of the galloping horse is fixed according to his stride. So now we're going to move on, Kirsty, and talk a little bit about problems with the upper respiratory tract. And in the upper respiratory tract, we're not talking about the lungs, we're basically talking everything from this point where the trachea divides in 2, right up to the tip of the nostrils. Any problems in the windpipe, the nasal cavity, and the nostrils is referred to as the upper respiratory tract. And really what we're looking at here is the main problem we're going to have there is upper respiratory tract infections, which are caused by either viruses or bacteria. Viruses, thousands of times smaller than bacteria, infectious in air droplets, much more infectious usually than bacteria, although there are exceptions. So they do produce two very different sorts of infectious disease. Probably the more common one, or definitely the more common one that we see, are viral infections. These are your coughing yards, your horses with snots, and usually these are quite mild. They're caused by several viruses. The most common virus is a herpes virus, which is a family of viruses we're familiar with for causing cold sores and things. In other species they call respiratory infections. The one that we'll all have heard of is influenza, which is less common, equine flu, because of the success of the vaccination program. But when we get a virus infection, we often don't know what that virus is. To actually diagnose the virus would require us to do a lot of swabs to the very base of the horse's nostrils, and then we perform immunofluorescence. It's not worth doing because most of the time these infections are self-limiting. We get a clear nasal discharge, the horse is coughing, he's not able to work, but it'll pass. In racing yards, obviously, if it affects a large number of horses and then once it all clears up, it kind of starts back again, you know, the way COVID did over the years, then obviously that can affect the season of a racing yard. So they are severe infections.
And I suppose when we're looking at nasal discharges, John, you know, consistency, texture, smell as well can be, you know, an indicator of where maybe that nasal discharge is coming from. If you have a nasal discharge that has a very strong smell, you may be looking at sinus issues or tooth root abscesses, other things like that. A lot of horses will actually have quite a clear discharge when they're worked, maybe just a slight clear. That's perfectly normal and nothing really necessarily to worry about, I suppose. So, you know, looking at nasal discharges, taking temperature, it's all kind of interlinked and really important. Is that right?
Yeah, absolutely. And a nasal discharge is, while it's common, it can vary widely. And things like if the discharge is coming from lower down in the horse, then as it passes up the trachea, it'll come down both nostrils. If a discharge is consistently coming down one nostril, then it's obviously more likely to be just something affecting that one side of the face, so a sinus or a tooth root abscess or something. The smell, absolutely. Normal viral discharges are clear. It's just a little bit of fluid that's exuding from the lining of the respiratory tract and ends up coming down the nostril. It's clear like this discharge. It's not sticky, and the horse may run a bit of a fever, but normally these viral infections are reasonably uncomplicated and don't need treatment. If we look at a primary bacterial infection as opposed to a virus, there really aren't very many, and the one that we'll all be familiar with, luckily less so nowadays, is strangles. Strangles is a primary infection caused by a bacteria, and that bacteria is called Streptococcus equi or strep equi. And while there are lots of infections that can look as if it's strangles, it's very important if you've got a suspected case that you take a swab, send it to the lab and confirm that it actually is strep equi, because that's got lots of repercussions as to the infectivity and the severity of the infection. And strangles is a bacteria, gets into the respiratory system, and it classically causes abscesses around the head and the jaw where the bacteria multiplies in the glands. And this foal here has got an abscess that's just about ready to burst. These horses will leak pus. This is quite an extreme case, but classically a horse with strangles will have swollen glands, it will have difficulty breathing due to the compression of the windpipe, and it'll be quite unwell. Strangles is extremely infectious, and if it gets into your yard, it's transmitted through clothing, through bedding, through buckets. So if you have strangles in a yard, you need to be very careful.
Biosecurity is key in that case, you know, making
Absolutely.
sure that you isolate correctly, changing clothes, all the usual stuff, because you just don't want it having an outbreak across your whole yard, really, do you?
Absolutely. And where there's a high throughput of horses coming in and out, that over the years is where I've seen most of the strangles outbreak, and it's just due to traffic, horses coming in and out. At some point you'll have a horse come in that's just recovering from strangles, but it's still shedding the bacteria in its nasal secretions, and as that horse moves around, it then spreads the infection. These are quite serious, although bizarrely, as you would think, the first thing to do is to wade in with antibiotics. It's not advisable to treat strangles with antibiotics, because if you do so, you slow the process of this abscess coming to a head and bursting and getting over and done with. And it has been known that giving horses with strangles antibiotics can actually just slow the horse clearing the infection from its body and actually getting abscesses elsewhere, primarily the abdomen. You sometimes get horses after strangles outbreaks having colicky signs, and I've certainly seen that. I don't know if you've seen that, Kirsty, with after strangles.
Yeah, you end up with these abscesses in very weird, bizarre places, and that. So it is definitely something that can last over a period of time, and you know that recovery period can be quite, you know, lengthy in some cases.
That's right.
Yeah.
That's right. Where bacteria, though, are probably more commonly found causing problems is a secondary bacterial. Viral infections are common, and once the virus has damaged the lining of the nasal chambers and the windpipe and the trachea, the bacteria can then get in and join the party. And they're not really nasty bacteria like strep equi causing strangles. They're just your average run-of-the-mill septic bacteria that will make the whole thing worse. They turn the discharge from clear viral to a nasty purulent discharge, and we can see that this horse has sort of got pussy discharge coming down both nostrils, which means the infection is coming from at least as far back as the windpipe, because it's coming up past the division in the horse's nasal cavity. So this horse has probably got a classic viral infection, which is then turned pussy as the bacteria has become involved. That can cause the horse to be sicker, as these septic bacteria just make the horse more unwell, and at this point it actually, this is the more common indication where you could need to put the horse in some antibiotics to clear up that secondary bacterial infection. Of course, the viral infection will just have to cure on its own, as we're all familiar with viruses nowadays. We're all experts. Viruses, just if you've got a healthy immune system, the horse will get over them, but you may need antibiotics in a situation like this. So really, Kirsty, that's it. I hope I have educated you a little bit more on
definitely, always, and I know this is going to lead on really nicely into our talk this afternoon, where we're going to hit on a bit more respiratory health and how to manage your horses, I suppose, as well. So thanks a lot, John, and we look forward to later on.
I look forward to it, Kirsty.
Thank you.
Bye-bye.